I have hundreds of thousands of dollars of medical bills.
Northport's Lynn Piazza says this is the bag of paperwork that now consumes her life. The 46-year-old social worker says she's being sued by the New York State Attorney General's office on behalf of Stony Brook University Hospital.
It's mostly filled with Stony Brook bills, Stony Brook collection notices, saying we're being sued by them. Better send this money in by this amount of time.
Piazza was working at Stony Brook when she went out on leave in 2019 after being diagnosed with brain tumors. She told us she was using paid time off, her own time plus time that was donated to her. But she claims a clerical error was made somewhere along the way, causing a lapse in her health insurance coverage, which she says is now causing all of her financial problems.
So there was a lot of back and forth. I called every department I knew in Stony Brook. Originally, people were trying to help me. They're like, how can this be? And then no one would call back.
Citing federal privacy laws, no one from Stony Brook would comment specifically on Piazza's case. But according to a Newsday analysis of Suffolk Supreme Court records, in the first 6 months of 2024, legal proceedings were launched against former Stony Brook patients more than 950 times.
It's pretty extraordinary what's going on out there.
Elizabeth Benjamin is Vice President of Health Initiatives at the Community Service Society of New York. The group helps patients navigate issues with health insurance.
To see these kinds of tactics brought by healthcare providers is really troubling.
So who's making the decisions? Stony Brook officials say they are required by New York State to report all accounts 180 days past due $2,500 or more to the Attorney General's office. However, the Attorney General's office says it's the hospital that makes decisions about debt collection. Stony Brook's Chief Revenue Officer, Brian Fullerton, says the safety net health system doesn't deny care to anyone regardless of their ability to pay, and offers charity care to patients earning up to 600% of the poverty level, even though the state threshold is 400%.
I think suing is really a last resort for us. We have a very robust financial assistance program that the patients all really are aware of. And we give discounts, we offer payment plans.
As for Lynn, she says she's still hoping for a resolution in court if she has to.
It's really stressful. It's exhausting. I did everything humanly possible.
For Newsday TV, I'm Shari Einhorn.